Hey, Greg. I thought we were switching it up today.
Hey, Polly, how you doing?
Good, Greg. How are you?
All right. Is it a mental freeze right there? Wow. So now you know how my day's going. Today on the podcast, we have a familiar face.
Woohoo.
We have Shannon Spurlock from JSI and RIPRC.
Nice.
Yeah,
So
so
you're gonna owe us a quarter, or you're gonna tell us what JSI and RIPRC
I'm
do?
gonna owe you a quarter. I'm gonna say Rhode Island Prevention Resource Center.
Yes.
All right,
Yeah.
JSI, you got me.
It's John Snow Incorporated or
All right,
something. Yeah.
I'll agree. I'll agree. You could have said just saying ink, and I would have been like, okay. But Shannon's here. She's gonna break down all the great things that RIPIC and JSI are doing, and tell us about the work that she's been doing for the 30 plus years that she's been in prevention.
Nice.
Yeah.
Yeah.
So we're definitely gonna learn more than what we normally learn in our trainings.
Okay.
All right.
Yeah.
So without further ado, joining us today on Totally Preventable, we have Shannon Spurlock, the Division Director of JSI and the Co-Director of RIPRC. Shannon, how are you doing today?
I am doing fantastic. It is such a pleasure to be here at the Totally Preventable podcast today. What an honor it is to have a chance to speak with you.
It's great.
I want to say, when I first got hired 11 years ago, one of the first things I needed to do, I think it was just by luck, but there was a training, at this building, I think it was the Paychecks building, on Wampanoag Trail, maybe, I'm not over there. And I want to say it might have been a spiff training
Wow.
and it was being put on by RIPRC. And it was like my first week, and I just got thrown right into it all. And Shannon was there. I met Shannon like my first week of work. So
Right.
Right to the wolves.
And you still want to talk to me, so I'll take that as a win.
I think of like our new staff here and how it's like kind of not a slow rollout, but we do a lot of online trainings and everything. And I'm like, I must have been like kind of intimidated by being thrown right in with everybody that knew. Like it was like I got teamed up with Gaby
Yeah.
in season.
About it.
Yeah, seasoned person, like there I am, first day of work. I don't know what prevention is, but
I tell you what.
Trial by fire. There you go. God, when you're here 11 years later, I'll take it as a win. I consider that a sustainable intervention because you're still in the prevention workforce. I consider that a win, a
Yeah.
positive unintended outcome. I'll take it.
I will say that Shannon and Rachel are like a dynamic duo because you have a way of making it seem like this training is the training that you must be in. You don't want to miss this one. If you miss it, you're done. And then you get that reminder, then you're like, oh yeah, I meant to do that. So great job.
Yeah. Yeah, Rachel Morris is my co-director for the RIPRC and has been a phenomenal partner in all of this. Her skill sets actually offset mine in a beautiful way. We have different leadership styles, and she's much more administratively focused, and I tend to be more vision focused. And so we have a really great partnership.
That is awesome. With over your 3 decades in prevention, how have strategies evolved in response to emerging public health challenges?
I think just the fact that prevention is really part of public health now, where they were kind of two separate fields. And I think preventionists have really integrated themselves in a public health approach, which I think is phenomenal. I think the biggest thing that has changed for me is the fact that prevention is really being recognized and acknowledged as an evidence-based strategy, and that we are much more science-based and research-based. I think historically, prevention was a feel-good thing that we did, and it was nice to know. And it was more kind of, we do fairs and we make people feel good. And what we know now in terms of prevention science is that it's so much more. It's around looking at social determinants of health. It's around looking at the whole person that you're working with. It's looking at a whole lifespan. It's engaging the whole community in an approach to support young people and other people who might be experiencing risk in communities. I think we also have a much more professional workforce and well-trained workforce that can speak to the evidence around prevention in a way that we did not have that kind of bandwidth historically. And I think in Rhode Island, we are particularly fortunate that we have regional prevention directors who are experts in their own right all across the state and can serve as resources to communities in a way that we never had that breadth and depth before. I think that's changed specifically in Rhode Island. But I think the field of prevention has really focused on understanding what is the science behind prevention, not just what is our opinion in the feel-good approach.
So in 2024, the Rhode Island survey, which we do every 2 years, indicated a significant decrease, which is great, in high school student use of marijuana.
Yeah.
Yep, and cigarettes. Yeah, an increase in marijuana use among middle schoolers. Can you interpret these trends for us and what you think some underlying factors might be?
I think I can provide some observations and thoughts around it. I get concerned when we talk about interpreting trends because that's more evaluation language, and I'm more of a programmatic person from this lens today. I think one of the things is that we spent a lot more energy focusing on high schools around prevention around cannabis and marijuana. I think that's first of all, because we had seen an increase in use. So we actually were able to show that by investing in high school students and educating and providing resources and more of a holistic approach around how we addressed cannabis and marijuana prevention at the high school, that we were able to show an impact. I think the main issue that we're having with middle schoolers is I think that we just thought they weren't using because they had lower rates before. But we're in the state of Rhode Island because we have a law that legalized recreational adult marijuana use. We also have more access to marijuana. So middle school students have access to a supply that they didn't used to have. People are using it in their homes in a way that they didn't used to. And when it was not legalized as a recreational substance in Rhode Island, I think we're also seeing that the conversation around marijuana use has changed because we have parents who are using. So how do we have that dialogue and say, that you're not allowed to do that when they're seeing adults in their communities that are using at a rate that they didn't see before? Also, marijuana is available in so many different youth-friendly packaging and ways. We have gummies, we have edibles, we have vapes, we have so many different ways that are really geared toward and marketed to young people. And what we know from our history around tobacco and alcohol and other issues, when it's marketed to young people, it works, right? And we haven't regulated the marketing in a way that we have for other legal substances yet. So I think that that's part of it. I think that the opportunity that we have, particularly with middle school students, is that parents still seem to be really engaged in schools and engaged in middle school in a way that they tend to drop off a little bit more in high school to allow their students to have autonomy and things like that. So I think we have a real opportunity to get into middle schools and implement some of those age appropriate strategies in middle schoolers that we had success with in high school, right? And then in addition to that, really engaging parents around locking up their substances in the way that they used to lock up alcohol and keep nicotine away, that we need to keep marijuana out of young people's hands. And more importantly, to pay attention that middle schoolers can and are using in a way that it's like, not my kid, they're too young. That's not going to happen. And the data is showing us something different, which means that our community-wide approach has to surround middle school students in a way that we were successful in high school.
It seems so prevalent now. Like we were talking about this yesterday, how you can just drive down the road and smell it. Like if you drove down the road and saw someone drinking a beer, that would be alarming, like that would, but all the time now you drive down the road, especially windows open now, and people are smoking, or you're out at the grocery store walking through the parking lot, people are smoking. And I think it has become so normalized or so public facing that it's really hard to express to young people that while the adults are doing this, you know, there are some dangers for you guys.
That's right.
Well, and also educating young people around the developing brain and that what is that adults can do that may affect them differently will affect you as a young person and affect your brain differently. Your brain is not done developing. You're still growing.
Mhm.
You want to grow taller, your brain is growing. Those are all things that are true. And that I think some of those messages can be embedded in a way that really speaks to middle schoolers in a way that we haven't necessarily, as much. Um, but I truly believe that our work really needs to be on thinking about policy. Like we have open container laws around alcohol,
Mhm.
right? And we have places where you're not allowed to use nicotine, but we have to expand our policies to include vaping of cannabis in addition to vaping of nicotine so that people aren't walking down the street using it.
Mhm.
I mean, if you think about the fact that you're smelling it in cars, right? Like, what are our open container laws around cannabis in vehicles,
Mhm.
Right.
right? If somebody had a fifth of bourbon sitting in the front seat of their car, people would pay attention.
Mhm.
The fact that they have cannabis, we don't have those open container kind of opportunities to hold people accountable. Because the bottom line is that if they're using while they're operating a vehicle, they're driving impaired, period.
Right.
And I think education around driving impaired and driving under the influence is also something that we can't let up on in educating the communities around and families around. You'll hear me say communities a lot because when we talk about the totally preventable approach, it is a community approach, right? And we can't just say this is a young people issue, this is a parent issue, this is a societal issue, and that we as a state have made a legislative choice that we are having outcomes associated with and that we need to respond to. And we have a lot of lessons learned as preventionists and public health prevention providers around how to approach these things. We've done it with nicotine, we've done it with alcohol. We knew going into this that this was going to be a challenge. And a lot of the challenges that preventionists identified are coming to fruition.
Mhm.
And that I think our prevention providers and our public health partners are the solution.
Completely off topic. I'm wondering if the THC beverage is considered open container.
Yes,
It is?
I think we looked it up in some of the legislation, but yes, I believe so.
All right.
I don't know. We've had a lot of THC beverage conversations around here, so.
Yeah.
I don't know. A lot of holes involved, but yeah.
Yes.
Now,
And things that we never even knew existed in terms of products. I mean, as
Right.
technology grows and access grows and products are growing. I mean, we've seen this over and over. I mean, every time, I say sometimes it feels like we're playing whack-a-mole, right?
Mhm.
We find this issue, we have a solution, and this comes up, and then they create another project. We saw this, it's true with the opioid issue and the opioid epidemic. As soon as we feel like we have created a solution, then they change on one particular component what's in it, and it's a new substance. And so
Mhm.
then it's not right. And so I think that is the richness and the fluidity of the field of prevention and also a challenge, right? I think we always have opportunities to learn, and there's always so much, which is doing this work for 30 years. I'm constantly evolving and constantly learning from communities and from young people, which I think is why young people are such important partners in the work that we do. Um, but I do think that we have to constantly be doing due diligence of learning what's on the market.
right.
Mhm.
And the cannabis, and now in drinkable form is a new one.
Now, JSI usually
Mhm.
emphasizes, or they do emphasize, community involvement and its prevention.
Yes.
Can you share examples of how community partnerships have enhanced the effectiveness of prevention?
Absolutely. I think that community partnerships are the basis of prevention. And that by getting input and building relationships with your community is how you have impact. I think schools play a very important role, parents play a very important role, business owners, key decision makers. those natural leaders in your community that may not have an official position, but have influence in the community, those are the partners that we need to be able to get information out to and provide opportunities for discussion. I think the more that we have a saturation of messaging around prevention in multiple sectors within our community, the more likely we are to have an impact.
Mm, mm.
I think the coalitions are a concrete example of how we pull our partners in. I think policy development is a concrete example of how we pull our partners in. I think discussions like the Totally Preventable podcast is an example of how we are building community in a broader sense. I think that this is an issue that we have to continue to connect with. I think medical providers are very important partners. I know I could probably go on and on about community partnerships because community organization is a passion of mine, but hopefully that answers your question.
Does, yes, it does.
I'm going to jump back to the Rhode Island Student Survey. And the survey reports decrease in feelings of sadness or hopelessness among high school students, which is great. What role do you think prevention programs have played in this positive decrease?
I think the approach of focusing on the whole person versus just a problem has been a big success. I think also looking at school culture and having the school environment be a more welcoming environment for students, for them to be present as a whole person, not just related to a problem they're having. I think that we have done a good job with that as preventionists. I think we get that there are certain protective factors that we can build in communities and coalition and communities, excuse me, in schools, and with parents and with teachers that really impact the students' experience in the school and feeling welcome and feeling safe. I think also connecting folks and particularly young people to resources in the community. And we've networked to create a web of supports around young people in communities. Again, going back to that community connection, to be able to say, you know, if you're having a hard time, these resources are available. We have student assistance counselors who provide prevention supports in schools. We have coalitions that provide prevention supports in schools. And then in addition to that, we have engagement with community partners. I don't think we can say there's like one prevention strategy that made that impact. I think it's the breadth, depth, and saturation of prevention supports that was able to influence that, hopefully.
Yeah. How do you rate the effectiveness of your prevention efforts?
I think that's a tough question because rating success depends on how you're defining success.
Right.
And what you're defining success around. Where I would say in Rhode Island, where we've been most successful is that we have built a professional prevention provider community that is competent and trained. And most of them are certified through our certification board in Rhode Island. So they're making informed evidence-based decisions in terms of strategies. I think to me, that is a success. The fact that we are integrating prevention in broader public health issues, to me, is a success. I think we're looking at the risk data to see changes in behavior. I feel like that's a benchmark of success. But I also think the definition of success changes depending on what substance comes on the market.
Mhm.
What political norms that we come into with every election cycle, that changes. What tragedies or epidemics occur within within the ocean state that we did not predict, or that we did predict and came to fruition. So I think success is something that has to be reevaluated on a regular basis. So for an example, all of the coalitions do strategic planning and needs assessment so that they can measure their own success in their communities and find out what measures are going to define success. And that changes because community norms change, what substances are available. I mean, there was a time when we were able to say we were making really strong inroads in the opioid epidemic, and then all of a sudden fentanyl became, and then carfentanil. And so we have all of these things that change. And even just to go back to the discussion that you were having, Polly, that mentioned the cannabis, the drinkable cannabis, like that didn't exist before in liquid form. And the loopholes around policies and political norms. So I think success is an evolving definition, and that we look at it on a regular basis, and that our coalitions do a good job of really looking at what's successful in their community. And then BHDDH tends to look at it, what we're looking at in terms of defining success as a state. I don't think that was a very concrete, succinct answer for you, but
It was great.
I had someone, I train people in Narcan and give out Narcan.
Yeah.
I recently had someone ask me, well, how many people have you saved by training people in Narcan? I do not know. Hopefully all.
How would you know? You don't know how many people implemented their skill set.
Right.
But the fact that they have the capacity to implement that is a success.
Right. Right.
It's not, the success isn't defined by whether you need it. The success is that if you need it, it's there.
Right.
And that somebody can help.
Right.
And so I think that that's part of the challenge of defining success, right? So I would say the fact that we're building capacity in communities, that if someone needs Narcan, that someone knows how to use it, knows how to call 911, knows how to get support, knows what to do, that they have the skill set, regardless if they ever have to use it, is a success.
Yes.
Right.
Yeah.
We're hoping that they never come in contact with somebody who experiences an overdose.
Right.
Because if we do a better job of overdose prevention, maybe they'll never have that experience. But boy, are we glad that they have the capacity if they do.
Right.
Yeah, absolutely. You're known around here at JSI for providing training and technical support and assistance to us and other stakeholders. How do these capacity building efforts contribute to the sustainability of prevention programs?
Well, I think first it builds a strong, competent workforce. Ideally, it increases the likelihood that people want to stay in their positions and do the work that they're doing because they're passionate and constantly learning and feeling like they're doing good work. Ideally, we're also making it appealing as a career path for folks, that people who want to work in the field of prevention see a role and see how they can expand and learn. I think that's where our challenge constantly is turnover and getting new people in the field, that it's a very under-promoted field, which is why I think integrating it into public health has been more of a success, because public health is a field that people promote and there's degrees in. So I think integrating content expertise in educational environments around, if you're interested in public health, prevention is also a career path. I think the certification process allows people to get the credentials to show the fact that they have this content expertise. I think that's definitely a benefit in Rhode Island that we have in terms of building capacity. But I feel like the more we are able to increase our workforce in our community's ability to be resilient and respond to whatever prevention crisis comes up, that's a success as a workforce and capacity building. Because regardless of what the substance is, the science around how to prevent it doesn't change.
Mm-hmm.
There's always going to be new substances. And I say it's a whack-a-mole kind of approach. There's always going to be something pops up. But if we build those relationships, our capacity to address them and be nimble and be competent and educated around it doesn't change.
Mm-hmm.
That kind of leads into my next question. Just like the definition of success is always adapting to the substances, when new public health emergencies such as COVID-19 pandemic or others pop up, how does JSI or how do you adapt to the prevention strategies to address those emerging threats while
Well, I
keeping
can, yeah.
on what already exists?
Well, I can say from a JSI kind of broader company perspective, we did a lot of work around mobilizing around COVID all across the country and in Rhode Island. But specifically related to prevention and through the Rhode Island Prevention Resource Center, we basically just moved all of our products to an online basis. So we just basically said, how do we provide what we're doing now well, and how do we do this virtually now and provide adaptability and to help local coalitions be adaptable as well. I think that COVID was a very unique situation that we don't necessarily have many public health crises that require us to stay at home. Um, I do think it changed the cultural norms around how we meet and get together. And I wouldn't say it's 100% positive. I think it's fantastic to be more inclusive and that people are more likely to meet virtually. But I do think that we're really missing out and it's been a real detriment to us as preventionists to lose those in-person relationships. You can't see people's nonverbals. You can't see what they're distracted by. You can't build relationships in the same way in a square that you can in person. And so I think that there was kind of a catch-22, and we're starting to come back to a community engagement where we're actually in person at the table. That's how you build trust. That's how you build engagement. That's how you build loyalty. That's how you build those relationships. So people want to show up because they care and they have a relationship. And it's much easier, I think, to be detached from a process if you're only talking virtually all the time. So I think there has to be a real combination of engagement in a way that we can do broad-based engagement. So more people are showing up, and maybe a more diverse group of people are showing up virtually. And that we have to partner that with our community engagement with in-person and skill-based engagement, which really requires an in-person hands-on opportunity for different learners.
Mhm.
I'm not sure if that answered your question.
Good.
But
We're struggling getting people back to in-person meetings. We have a couple coordinators here who are really, really trying to make it happen.
it's
and
hard.
It's hard, but I noticed yesterday that one of them had an in-person meeting, and the conversation was so much more candid because you knew who was listening, right? There was no one's husband in the background or kids maybe that were listening. We all just really felt comfortable to just speak freely. And for a long time too, we
Yeah.
chatted.
Well, and also just to be able to have that person-to-person contact.
Yes.
Because they can read your nonverbals too, and they can say, this is a person who knows their stuff, who's approachable and cares about me as a person versus just a number in a box. And I think I feel like that's very dismissive. I don't want to say that we can't have great interventions virtually. I think we can. I just don't think that that should be the sole way. I mean, we've struggled with that from a training and technical assistance perspective. People don't want to come in person. They don't want to drive and come to a meeting. They would prefer to do it virtually because it's easier, it's more convenient.
Mhm.
And what I would say is in some cases, if I'm just doing knowledge exchange, which I'm sharing information and that's it, then I think that that's fantastic and that's easier we can do that virtually or in person. But if I'm trying to teach a skill where you're trying to implement something later on and you need to implement that skill on your own, it's important to have that in-person opportunity to practice with someone witnessing it, giving feedback, opportunity to practice again and implement together. And more importantly, to network with other providers to find out how they're doing it well.
Mhm.
They're less likely to share the resources on a Zoom than you would in person because oh, I did that and I bet you would like that. You don't see that synergy happening in the same way when we're not in person. And I think that's true with communities. I see it in schools too. I mean, I have two young adult children and I watch them just how they socialize. It is so different.
Mm.
Because I'm a lot older, so I'm just owning that. But it's just so different in terms of how they socialize and build relationships and the types of relationships they have, I think are so much more superficial in
Mm.
many ways because they don't have that richness of in person. And then when the people get together in person, the richness of what they learn from each other, particularly if you're coming from another community, and I think diverse communities are really important. If you show up in person, the richness of that is so much more important for both of the participants and in relationships and in friendships. And then we need to teach people how to be people again around other people. And that is a new cultural norm that we didn't have to think about before COVID.
Right.
Yeah.
I think about that every time when text messages go through. Like, I don't know. I know in caps it's supposedly yelling, but I don't know how you took what I'm trying to say. I don't
Yeah.
know how you're relaying this message back to me. Are you upset? Are you not upset? Are you happy with it? So
Mm.
I completely agree with what you're saying there.
I am a pretty sarcastic person in general. But when you're talking to me, I'm usually know I'm being sarcastic because I'm smiling or whatever.
Yeah.
But so I have learned to often put like a winky face or an LOL.
Yeah.
People know because otherwise you just think I'm being a jerk. How do you guys incorporate youth into prevention, and how do you give them a voice and make them culturally relevant?
I think that happens more on a local level than it does from a capacity building perspective. Um, I think, all of the local coalitions usually have some kind of youth engagement, either a youth board or they have a youth member on their coalition or they have youth groups or they're engaged through schools, either on a regional or municipal level. I think that happens because they're more doing direct service. Um, how I usually engage youth, quite frankly, on a technical assistance and broader level is if I'm developing new curricula or new content, then I will recruit from communities for people to take a look at it. Or I will do, some kind of focus groups or key informant interviews. So through JSI, I have been hired to go out and implement focus groups with young people around a variety of topics. I've done it around substance use prevention. I've done it around HIV. And I feel like I have learned so much from having those conversations around implementation. I think how we benefit from engaging youth is the bottom line is that we know we're on the mark. And youth is a culture. And youth culture looks different whether you're in a rural community or whether you're in an urban community or a suburban community. Youth and age wise, and then we also have to remember that there are folks with developmental disabilities and other challenges that we don't necessarily include, behavioral health challenges, and the importance of talking to youth who are experimenting with substances and not only talking with people who already have protective factors and support factors in place and aren't using. And that we learn so much. I learned so much talking to people who are currently using around what prevention messages didn't work and how it didn't reach you and why you're using. I think that we always make the assumption that people are using because they want to get high. And a lot of times the reason young people are using is because they are medicating themselves because of a behavioral health challenge, either depression, anxiety, social anxiety. They haven't built the communication skill set to be able to talk to their peers. So they are self-medicating. And I think if we go into the assumption that they're just doing it to feel good, then we're missing the mark. And where we have the opportunity is to say, what I'm hearing is that, and I remember having this conversation with a young person that he said to me, when I'm at people's house and I want to talk to somebody, particularly somebody of the opposite sex, I get so anxious that I just get quiet and shut up. But if I use cannabis, I can have a conversation. And I said, so it's not cannabis so that you feel high. It's cannabis so that you can have a social interaction and combat your social anxiety. And I can build skill sets around communication skills and how to deal with social anxiety. That's something I can address without cannabis. We as preventionists can do something about that.
Mm-hmm.
Cannot necessarily say we can get you high on something else, right? We can say that is not something I can't provide an alternative high, but I can provide an alternative to behavioral health challenges, and then we have strategies around that are evidence-based. I think that was a very long-winded answer to that question. You may want to edit that.
That's a great answer. It actually leads me right to my next question. It's looking ahead, what emerging trends do you see? What innovative prevention strategies or prevention science do you anticipate will help shape our next decade?
I think prevention science is going to definitely have to catch up around AI, artificial intelligence. I think that we need to figure out how to understand it and how it plays a role positively and negatively in the prevention field. I will go so far as to say, as a seasoned professional, this is not an area that I have the most expertise in, and I've just recently started getting some training around it. And I will acknowledge that I am a highly biased person, and I am very suspect of AI. But because of the limited capacity that I do have, it makes me want to learn more and understand more. And how do we harness that in a different way? I think that we as preventionists need to evolve in our language around how we talk about substances, particularly with young people, but also with families. I think that we are definitely in much more of a generation of looking at harm reduction models, where historically prevention incorporated harm reduction, but it was harm reduction light. And I think now, as preventionists, and the more that we learn and more the evidence is showing us that harm reduction has a role in prevention, and we need to figure out how it has a role as we evolve. And more importantly, how do we change our language? How do we define success? And so if we only define success as abstinence, is that going to be, the right benchmark for us? I don't know. I think we just have a lot to learn. I think we're learning a lot around the legalization of cannabis, that there definitely needs to be research around how this worked and how it didn't work and the public health impacts. I think that is a field that we need to continue to study. We need to continue to look at nicotine and vaping and tobacco products because they stay on the market. And we need to continue to look at how we approach alcohol, because alcohol is still the leading substance that, if you look in the field of treatment, alcohol is still the leading substance used. And I think that a lot of times when we were dealing with the tragedy of the opioid epidemic, and I don't want to belittle or negate that as a public health crisis, it absolutely is. But I think we spent a lot of time and energy focusing on death prevention. And that because it was a crisis. So we kind of had to, in the same way that we had to have we had a crisis approach around COVID. But I think moving forward, we need to think about what are the most common substances used and what are killing people on a larger scale. We look at tobacco and nicotine, and we're looking at alcohol. And if you look at who's showing up for treatment, though the opioid epidemic is happening, and it is important to do the Narcan training, it is important for people to understand the Good Samaritan law. It is important to reduce access to harmful, opioids in the market. That is not necessary. It's not either or. It's a yes and. And we have to continue to ensure that young people aren't getting access to cannabis, alcohol, and nicotine products. And we have to ensure that our approach is not just a punitive approach, but also includes restorative practices to figure out how do we work with a person where they're at. So maybe it isn't that they never ever use cannabis, but they don't use cannabis and drive, or they don't use cannabis daily, or they're more thoughtful around how they dose themselves in a medical model, and how do we have that conversation. So maybe it is at a party when they can't talk to somebody of the opposite sex that they're going to dose themselves, but they're making a decision to dose themselves and look at it in a dosage kind of way, in a medicalized approach versus a recreational, just a feel good approach. So I think there's a lot of different ways of looking at harm reduction. And I think Rhode Island is really leading the nation in looking at some of these issues, particularly because we have an overdose prevention site. Some people refer to it as a safe use site. We are the only state has a statewide one, and it's very controversial. There are a lot of people with really strong opinions around it, but I think we need to do the research and science. Say, what are we learning?
Right.
So Shannon, in your 30 years in prevention, what are you most proud of? And what lessons have you learned?
I think I'm most proud of seeing how many other prevention experts are in the field now. And that there are true experts out there that are all across the state, that it's not isolated to one or two people, but we have a broad base of professionals that are highly competent, well-informed, and doing really amazing work. I feel very proud about that. One of my most proud moments was when I had done a facilitation training. This was probably about 10 years ago now, because now my life, I think about not in days, but in terms of decades. It happens at this particular stage of my career. And I heard somebody was facilitating a meeting and they were mirroring what they learned in the training and they were implementing it. I saw it in person. And that they owned it as their own skill set, their own content expertise. They didn't say, I learned this from Shannon, or I learned this from here, or whatever. It wasn't about the training. They were implementing it and owning it and demonstrating their ability to use the skill. Whenever that happens, I get really excited because that means, if people only connect their ability related to a particular training or a person, then they don't earn it. That's not building capacity. That's building knowledge. But if I'm building capacity and people are implementing it and owning it and say, I am the expert, I don't need to ask anybody else. I have this knowledge, then I feel like that is a huge success. And I see so many people who are able to do that. Like you were talking, Polly, earlier that you came in and you were like completely, blindsided by prevention, right? When you started. And here 11 years later, you are the expert. To me, that is a success. So just seeing you here at this totally preventable podcast is a success. And I consider that a success because you are a competent prevention provider who had some capacity building that may have come in contact with RIPRC or JSI.
Thank
So
you.
you're a success.
I would consider that a success. I mean,
Yes.
and the fact that after all these years that you still are interested in learning more. And you don't see yourself as a stagnant person, but a person who's evolving and learning. I think in terms of things that I feel the most frustrated by or feel like we haven't had a success, I feel like we really missed an opportunity with the legalization of recreational adult cannabis use in the fact that we really had some really strong prevention recommendations through the Prevention Advisory Committee that were provided and weren't utilized. And that if our key decision makers had read that and paid attention to it, it would have mitigated a lot. They could have built in to the policies some of the prevention challenges that we are dealing with now. We would have been able to prevent those in place, like using in public places, advertisements, things like that we already knew how to respond to, and that we had the evidence around, and that we missed that opportunity. And I don't mean that we as prevention missed the opportunity, because I feel like we provided the information. I feel like we as a state and our key decision makers did not utilize the content expertise that they were given. And when we provided those recommendations to key decision makers, they chose not to utilize them. And I feel like that was a really missed opportunity for the prevention field, but also for us as a state.
This has been so informative. Thank you so much for your time, Shannon. This has just been great.
Great.
Yeah, it was great to see you again and great to talk to you. Have a little
Well,
time.
thank
I think we're always rushing around when we see each other. So this has been
I know, I'm always doing something. I'm never bored. That's the best thing in the field. I've been working at JSI for over 25 years, and people will say to me, how do you how are you in one place? And I said, because I'm constantly learning and I'm never bored because I'm never doing the same job. I'm always learning. I'm always doing something different. And I think prevention provides that opportunity. And I think one of the cool things about prevention as a field is it's at a place of hope.
Mm.
I find that prevention and recovery supports are the place that I get a lot of energy professionally and personally, because those are two places of hope. And I think that's what's exciting about the field of prevention. So thank you very much for having me on the Totally Preventable podcast. It was an honor to be here, and hopefully I provided information that can be useful.
You definitely have.
Absolutely.
Have a great rest of your day.
Thank you so much.
Thank you. You too. Bye.